Picture a 74-year-old man named Gerald sitting in his recliner on a Thursday evening. He has been taking his blood pressure pill every morning for 3 years without missing a single dose. His doctor is happy with his numbers. His wife is happy with his numbers. Gerald himself feels fine, mostly, except for his ankles. They started swelling about 8 months ago, not dramatically, just enough that his shoes feel tight by the afternoon. He mentioned it once to his doctor, who told him it was probably just age, just gravity, just the way things go. Gerald nodded. He went home. He kept taking his pill. What nobody told Gerald is that the swelling in his ankles is not age. It is not gravity. It is a direct, documented side effect of the medication that is supposed to be protecting his heart. And there are 3 other things happening inside his body right now that his prescription label does not mention, and that his 10-minute appointment did not have time to cover. Every year, more than 70 million prescriptions for amlodipine, one of the world's most commonly used blood pressure medications, are written in the United States alone. The majority of those prescriptions go to people over 60. And the majority of those people have never been told what this drug actually does inside their bodies, how to take it in a way that reduces its risks, or what it is silently doing to specific systems that seniors depend on most. By the end of this video, you will know exactly what amlodipine is doing inside you, which warning signs to watch for that most people dismiss, and a set of daily habits that work with this medication, not against it, to give your heart the best possible protection. Here is what most people believe about blood pressure medication. Once you are on it, it is doing its job. Your numbers are controlled, and that is the whole story. Check the box. Move on. That belief is costing seniors their quality of life, and in some cases, far more than that. The medical literature on amlodipine's effects on the aging body is unambiguous, and it says that controlled blood pressure numbers are only one part of a much more complicated picture. The drug works, and it has consequences that almost no one is being told about clearly enough. That is what this video is for. If you are watching this channel for the first time, subscribe to Fauci Health Insights right now and tap the like button. It takes 4 seconds, and it matters more than you think. We are working toward 50,000 subscribers, and this channel exists on one principle. The medical system is designed around appointments that are too short, incentives that reward procedures over prevention, and the assumption that handing you a prescription completes the job. It does not. What I am about to tell you today is the part that comes after the prescription, and it is the part that almost never gets said out loud. So let me show you what is actually happening inside your body when you take amlodipine, because once you understand the mechanism, you will never look at that little pill the same way again. Your cardiovascular system, the network of your heart, arteries, and blood vessels, is one of the most elegantly engineered structures in the human body. Your heart beats roughly 100,000 times per day. Your blood vessels, if you stretch them end to end, would circle the earth more than twice. And running through all of it constantly is a process of pressure management so precise that a variation of just a few millimeters of mercury can mean the difference between a normal morning and a medical emergency. Think of your blood vessels as a garden hose. When the water pressure inside that hose is too high for too long, the hose walls begin to stiffen, crack, and eventually bulge. That is exactly what chronic high blood pressure, hypertension, which simply means the force of your blood pushing against your vessel walls is consistently too strong, does to your arteries over years and decades. Amlodipine works by relaxing the walls of that hose. It belongs to a class of medications called calcium channel blockers, meaning it slows the entry of calcium into the muscle cells of your blood vessel walls and heart. Calcium is what tells muscle cells to contract, to tighten. Less calcium entry means less tightening. The hose becomes more flexible. The pressure inside drops. The heart does not have to work as hard. On paper, this is elegant. It genuinely works. But here is where it gets important for people over 60. The aging cardiovascular system is not the same hose it was at 45. The walls are already stiffer. The pressure regulation system, managed partly by your kidneys, partly by hormones, and partly by the nervous system, responds more slowly and less precisely. When amlodipine relaxes those vessel walls, the results are not always smooth and predictable. Sometimes the pressure drops too quickly when you stand up. Sometimes fluid that should stay in circulation leaks out into surrounding tissue. Sometimes the drug interacts with the slower, less adaptive physiology of the aging body in ways that produce symptoms people are told are just getting older. That is the tipping point, not a dramatic event, a slow, quiet shift that most people, and many doctors in brief appointments, never connect back to the medication that started it. Sign 1. Ankle and leg swelling that gets worse as the day goes on. You wake up in the morning and your ankles look perfectly normal. By mid-afternoon, you notice your socks have left deep marks in your skin. By evening, your shoes feel a size too small and your lower legs feel heavy, almost waterlogged. What is actually happening is this. Amlodipine relaxes the walls of your blood vessels, including the tiny capillaries, the smallest vessels in your legs and feet. When those walls relax too much, fluid leaks out of the vessels and into the surrounding tissue, where it collects under the influence of gravity throughout the day. This is called peripheral edema, which simply means excess fluid pooling in the tissues at the outer edges of your body, away from your core. Most people tell themselves it is the heat, or that they have been on their feet too long, or that this is just what aging legs do. It is not age. It is your medication producing a known, documented side effect that affects up to 30% of people who take amlodipine, and the risk is significantly higher in seniors whose vascular walls are already less elastic and whose lymphatic drainage, the system that clears fluid from tissues, runs more slowly. If the swelling is ignored, chronic fluid in the tissue can cause skin changes, increase the risk of skin infections called cellulitis, which means a bacterial infection in the deep layers of the skin, and in severe cases, create enough pressure to affect circulation in the lower limbs. A physician who hears this described will not dismiss it. They will evaluate whether your dose needs adjusting or whether a companion medication called a diuretic, a drug that helps your kidneys remove excess fluid, is needed. But first, you have to know that the swelling is a signal, not a given, not age. A signal. Sign 2, dizziness or unsteadiness. When you stand up, you have been sitting down for an hour at dinner, in a chair, in the car. You stand up, and for a moment, the world tilts. A brief graying at the edges of your vision. A sensation that the floor is less certain than it should be. It passes in 3 or 4 seconds and you think nothing of it. This is called orthostatic hypotension, which simply means a drop in blood pressure that happens specifically when you change position from sitting or lying to standing. Normally, your body compensates for standing up almost instantly, squeezing blood vessels in the legs to push blood upward to the brain. In people taking amlodipine, those vessel walls are pharmacologically relaxed. The compensation mechanism is slower. Blood pools briefly in the lower body. The brain gets slightly less blood than it needs for those few seconds. The excuse is always the same. I just stood up too fast. That explanation sounds reasonable. The danger is that it is not complete. In people over 65, this momentary dizziness is one of the leading contributors to falls. And falls in seniors are not minor events. They are the leading cause of injury-related death in people over 65. The clinical name for the condition that causes this is amlodipine-related postural hypotension. And when a cardiologist hears a senior describe regular dizziness upon standing while taking a calcium channel blocker, the next steps are not reassurance. They are a medication review, a blood pressure check in multiple positions, and potentially an adjustment in dose or timing. Do not dismiss the tilting world. That is your body sending you a very specific message about what your medication is doing in the first moments after you stand. Sign 3, unusual fatigue that does not match your activity level, not the tiredness that comes from a long day, not the fatigue that improves with a good night's sleep. This is a persistent background heaviness, the sense that your body is working harder than your day would explain. Amlodipine's relaxation of blood vessel walls affects not just large arteries, but the microcirculation, the fine network of tiny vessels that delivers oxygen to muscle tissue throughout your body. When that delivery system is running at lower pressure than your muscles are accustomed to, the muscles work less efficiently. They fatigue more quickly. The signal they send to the brain is one of generalized tiredness that has no obvious cause. People tell themselves they are simply getting older, that this is what 68 or 72 feels like. That energy is supposed to decline. This is not the natural trajectory of aging. It is a physiological response to altered perfusion, which simply means altered delivery of blood and oxygen to tissue that deserves clinical attention. When fatigue like this develops after starting or increasing a calcium channel blocker and does not resolve with rest, it is a flag, not a footnote. Sign 4, gum tenderness or unusual gum. Growth, this one, surprises almost everyone. You notice your gums look slightly fuller than they used to. Perhaps they bleed a little more easily when you brush. Perhaps your dentist mentions something at your last cleaning. A rare but real side effect of long-term amlodipine use is gingival hyperplasia, which simply means an overgrowth of gum tissue caused by the drug's effect on the cells that line the inside of your mouth. Calcium channel blockers affect more than just blood vessel walls. They influence a range of calcium-dependent cellular processes, and in some people, particularly those with existing gum inflammation, this produces visible changes in gum tissue. Most people blame poor brushing. Most dentists, unless they know your full medication list, may not immediately make the connection. The danger beyond the discomfort is that gum overgrowth creates pockets where bacteria collect, which can worsen oral inflammation, and oral inflammation has documented connections to cardiovascular risk. A cardiologist who hears this described in a patient on a calcium channel blocker will ask immediately how long they have been on the medication and at what dose. I want to tell you about a patient I will call Margaret, 68 years old. The kind of woman who had worked as a school librarian for 32 years, kept a meticulous garden, and had read the label on every medication she had ever taken since her 40s. She was careful. She was informed. She was, by every standard she had ever been given, doing everything right. Margaret came to see me 14 months after starting amlodipine. Her blood pressure was well controlled. Her primary care physician was pleased. But Margaret was not pleased. Her ankles were swelling every afternoon. She felt tired in a way that a full night's sleep was not touching. And she had started grabbing the wall when she stood up from her kitchen table. She had been told it was age. She had been told to reduce her salt. She had elevated her legs in the evenings. She had done everything she could think to do based on the information she had been given. I stopped asking about the swelling and started asking about her day. What time she took her pill, whether she drank water in the morning, how quickly she stood up after meals, what she had eaten in the last 48 hours. What I found was not a failure of her medication. It was a failure of the conversation that should have surrounded it. Her dose was appropriate. Her timing was wrong. Her fluid intake was insufficient. And 3 habits she had kept for years were working directly against what her medication was trying to do. She looked at me about 20 minutes into that appointment and said something I have thought about many times since. Nobody told me there was a right and wrong way to take this pill. I thought you just swallowed it. She left that appointment with information she should have had the day the prescription was written. 12 weeks later, the ankle swelling was largely resolved. The fatigue had improved significantly. She had not changed her medication, only how she lived around it. Let me now show you what is actually happening underneath all of these signs, because it is happening in the majority of people watching this right now who are on amlodipine, and almost none of them know it. The root cause connecting all of these signs is not the drug failing. It is the aging body's reduced ability to buffer the drug's effects. When you are 70, your kidneys clear medications more slowly than they did at 50. Your nervous system's reflexes, including the reflexes that regulate blood pressure moment to moment, respond with less speed and precision. Your fluid balance is managed by hormonal systems that have become less sensitive over decades. This goes undetected for a simple reason. You feel nothing unusual at first. The drug works. The numbers look good. The appointment is short. Nobody is asking about your ankles at 4 in the afternoon. The garden hose analogy holds here. Imagine the hose pressure is managed by a set of sensors along its length that detect pressure changes and signal the pump to compensate. In an aging body, those sensors are less responsive. The drug relaxes the hose wall, and the compensation mechanism takes longer to catch up. The result is not obvious. It is quiet. It is the kind of shift that accumulates over months until it becomes something you mention to a doctor almost as an afterthought. And by that point, the secondary effects, the fluid in the tissue, the altered oxygen delivery, the fall risk, have often already established themselves as part of daily life, accepted, attributed to age, never corrected. Now, I want to tell you about the everyday things you are probably doing right now that are making this process faster. The first is grapefruit. Not a strange food, not a supplement, grapefruit, which millions of seniors eat as part of a healthy breakfast. Grapefruit contains compounds called furanocoumarins that block a liver enzyme called CYP3A4, which is simply the enzyme responsible for breaking down amlodipine in your body. When that enzyme is blocked, your body cannot clear the drug at its normal rate. Amlodipine levels in your blood rise higher than your prescription intends. Within 2 to 4 hours of eating grapefruit alongside amlodipine, you may have significantly more of the drug active in your system than your doctor prescribed. The result is an amplification of all the side effects described above. More swelling, lower blood pressure, greater fall risk. The second is high sodium processed food eaten in the evening. Most people over 60 understand salt and blood pressure in general terms. What fewer understand is the specific timing effect. Eating high sodium food in the evening, crackers, deli meat, canned soup, packaged snacks, causes your body to retain water overnight. By morning, your blood pressure has risen above its overnight baseline. When you take amlodipine in the morning after a high salt evening, the drug is working against a higher starting point, and the compensatory drop in pressure can be sharper, increasing dizziness upon standing in the first 2 hours after your morning dose. The third is insufficient morning hydration. Blood is at its most concentrated, its thickest, its most viscous, after 6 to 8 hours without fluid during sleep. Taking amlodipine on top of dehydrated, thicker blood without rehydrating first makes the drug's pressure-lowering effect act on a vascular system that is already under the strain of thickened blood. The interaction increases the likelihood of a blood pressure dip that is faster and deeper than intended. Now let me show you what actually works and why it works at a level your body can feel within days. The Amlodipine-Aware Daily Protocol Morning. The first 15 minutes before you take your medication, drink 500 milliliters of water. That is 2 standard glasses at room temperature. Sit upright while you drink it. Do not take your pill while still in bed or immediately after lying down. Allow your body 5 minutes in a seated position before standing. What this does, it rehydrates your blood before the drug's pressure-lowering effect begins, reducing the sharpness of any morning blood pressure drop. The seated pause gives your nervous system time to prepare your vessels for the change from horizontal to vertical before the drug's peak effect arrives. The common mistake is swallowing the pill the moment you wake up while still lying down, then standing immediately. This combines the drug's pressure effect with gravitational redistribution of blood all at once. It is the most common reason for morning dizziness in amlodipine users. Daytime. The position rule: anytime you have been sitting for more than 30 minutes, stand up in 2 stages. First, sit at the edge of your seat for 15 seconds before rising fully. Place both feet flat on the floor, then stand slowly, keeping one hand on a stable surface, not to catch yourself, but to have contact with something fixed while your pressure adjusts. What this does, it gives your nervous system's pressure sensors, called baroreceptors, time to signal your vessels to tighten before your full body weight shifts upward. In amlodipine users, this 2-stage process compensates for the slower reflexive response that the medication produces. People with existing balance concerns or knee problems should discuss modifications with their doctor before practicing any positional exercise. Evening, the sodium in grapefruit, check eliminate grapefruit from your diet entirely while on amlodipine, or speak with your doctor about whether an alternative citrus could replace it. For evening meals, aim to keep sodium below 600 milligrams. Check the label of anything packaged. A meal of fresh vegetables, a lean protein, and water or herbal tea in the evening reduces the overnight sodium retention that makes the next morning's dose more disruptive. Consistent practice of this protocol over 2 to 3 weeks typically reduces ankle swelling noticeably, improves morning steadiness, and reduces the background fatigue that most amlodipine users have accepted as normal. Now, here is something I want you to think about. Your age changes everything about how quickly amlodipine affects your body's regulatory systems. The same dose does measurably more in a 70-year-old body than it does in a 55-year-old body, because the kidneys that clear it, the reflexes that buffer it, and the fluid systems that respond to it all slow with age. Research shows that in people over 65, adverse effects from calcium channel blockers occur at nearly twice the rate seen in younger adults on identical doses. How old are you right now? Write it in the comments. I ask because it shapes every video I make next. I want to know who I am speaking to most. Here is exactly what to do after this video ends. 1. Write down every symptom you have noticed since starting amlodipine with approximate dates and times of day they tend to occur. Take this list to your next appointment. Do not mention it in passing. Hand it to your doctor in writing. Point 2. Remove grapefruit from your diet today. This requires no appointment, no permission, and produces an immediate reduction in drug interaction risk. 3. Starting tomorrow morning, drink 2 glasses of water before taking your pill. Sit upright for 5 minutes first. Time how long you've been doing the opposite. 4. Begin the 2-stage standing technique at every transition from sitting to standing. Practice it deliberately for 1 week until it becomes automatic. 5. Check the sodium content of your 3 most frequently eaten evening foods. Note which are above 400 milligrams per serving. 6. Ask your doctor specifically about an orthostatic blood pressure check, a measurement taken lying down, then sitting, then standing, to see whether your blood pressure is dropping significantly when you change position. This is a specific name test. Ask for it by name. Point 7. Ask whether your current amlodipine dose is calibrated for your age-adjusted kidney clearance rate, a value called your eGFR, which simply means an estimate of how well your kidneys are filtering your blood. Many seniors are on doses set years earlier that have never been reevaluated as kidney function slowly changes. 8. Share this video with one person you know who takes blood pressure medication. You will likely not have to think hard to find someone. Start with step 1. Do it today. The rest will follow. I am Dr. Raymond Holt, and I have been practicing cardiology for 15 years. I made this video because of patients like Margaret, people who were doing everything they had been told to do and were still experiencing side effects that nobody had taken the time to explain. That bothers me. It bothers me because the explanation takes 20 minutes and the prescription takes 30 seconds, and somehow the system has decided the prescription is sufficient. Here is the specific failure I want to name, because vague system critique helps nobody. The structure of the modern outpatient appointment, typically 10 to 15 minutes for an established patient, is not designed to include education about how a drug interacts with the aging body over time. It is designed to renew, to adjust, to document. The education that should surround a long-term prescription in a senior patient requires time that is simply not reimbursed at the same rate as procedures. So it does not happen. Not because your doctor does not care, most do, deeply, but because the architecture of the system makes thorough medication education economically invisible. That is the gap this channel exists to fill. One video at a time, one person at a time. We are working toward 50,000 subscribers, and every person who joins this channel is someone who has decided that understanding their own body is worth 20 minutes. Subscribe now. It is how this reaches the people who need it most. If this reached you at the right moment, send it to one person who needs to hear it. You may never know what that one share does for them. Everything shared in this video is for education and understanding. Your situation is specific to you. Use this as the starting point for a real conversation with your own doctor, not as a replacement for one.